Hi friends, welcome back to 1000 questions and answers series. First question, breast milk is rich in all except lactose, polyunsaturated fatty acid, sodium, lactoalbumin. And the answer is sodium. Next question. Mouth-to-mouth respiration provides what percentage of oxygen? 10%, 16%, 21%, 100%. It's 16%. Next question. Nasal cannula is used for oxygen administration, clearance of secretion, feeding milk, both A and B. It is used for oxygen administration. Next question. Which drug is given through nebulization as well as intravenous route? Salbutamol, budesonide, 3% NaCl and hydrocortisone. Answer is salbutamol. Next question. Phototherapy is used for the treatment of cyanosis, jaundice, diarrhea, eczema. It's used for jaundice. Next question. Reduced speech production is termed as poverty of speech, mutism, poverty of ideation, echolalia. It's poverty of speech. Next question. Multi-drug resistant tuberculosis treatment involves all drugs except kanamycin, pyrazinamide, rifampicin, ethambutol. And the answer is kanamycin. Next question. The most appropriate test to assess the prevalence of tuberculosis infection in the community is sputum examination, pyrazinamide, tuberculin test, clinical examination. And the answer is sputum examination. Next question. The difference between rectal and oral temperature is by The answer is 1 degree Fahrenheit. Difference between rectal and axillary temperature is 2 degree Fahrenheit. Next, the landmark for measuring the length of nasogastric tube is nose epigastrium, tragus epigastrium, nose tragus epigastrium, mammary line epigastrium. It's nose to tragus and tragus to epigastrium. Next, the most common cause of spontaneous abortion is physical trauma, unresolved stress, congenital defects, germ plasma defects. It's due to congenital defects. Next question. A blood transfusion should be started at how many macro drops per minute and for how long time? 10 drops per 10 minutes, 20 drops per 10 minutes, 25 to 50 drops per 15 minutes, 120 drops per 15 minutes. It's 10 drops per 10 minutes. Next question. Which of the following IUDs belongs to group 2nd IUDs? Copper T200, Lipis loop, copper T380A, then Ml250. It's copper T380A. Next, Janani Suraksha Yojana has been started as under CSSM, NRHM, MCH, ICDS. It's under National Rural Health Mission. Next question. When administering an IM injection to an infant, the nurse should use which site? Deltoid, dorsogluteal, ventrogluteal, vastus lateralis. Should use vastus lateralis. Recommendation. Next question. The coronary care unit nurse dons an arterial blood sample to assess the client for acidosis. A normal pH of arterial blood is 7, 7.42, 7.30, 7.50. It's 7.42. Next question. A patient with heart failure is on diuretics. Which is the accurate indicator of such patient's health status? Vital signs, urine specific gravity, fluid intake and output, weight. The answer is weight. Next question. Which route of drug administration provides a rapid response in a patient? Oral, intramuscular, sublingual, subcutaneous. And the answer is sublingual. Next question. Which type of data does auscultation provide? Medical, secondary to administer, objective, subjective. And the answer is objective data. Next question. Which of the following is a reason for intradermal injection to be used for testing allergic reactions? It is less painful, it is easy to administer, it diffuses rapidly, it diffuses slowly. The reason is it diffuses slowly. Next question. In which type of sleep do most vivid dreams occur? Hibernation sleep, rapid eye movement sleep, non-hibernation sleep, non-rapid eye movement sleep. It's rapid eye movement sleep. Next, the first line of intervention for prevention of infection is wearing gloves, washing hands, administering antibiotics, assigning private room for partners. Answer is washing hands. Next question. Which of the following listed drugs is proton pump inhibitor? Sucralfate, famotidine, ranitidine, pantoprazole. And the answer is pantoprazole. Next question. Vertigo is due to a problem in external ear, tympanic membrane, inner ear, middle ear. It's due to a problem in inner ear. Next question. Surgical repair of hernia is fistulectomy, herniorrhaphy, herniectomy, laparoscopy. It's herniorrhaphy. Next question. The ECG of a patient shows depressed T wave. The antihypertensive that the patient is taking is amiloride, aldactone, spironolactone, furosemide. And the answer is furosemide. Next question. Which of the following increases the absorption of iron tablet? Thiamine, riboflavin, tranexamic acid, ascorbic acid. And the answer is ascorbic acid. Next question. A water-soluble vitamin used for the treatment of hyperlipidemia is thiamine, riboflavin, niacin, pantothenic acid. It's niacin. Next question. An anti-tubercular drug which causes direct injury to the 8th cranial nerve. Isoniazid, rifampicin, ethambutol, streptomycin. And the answer is streptomycin. Next question. Which of the following causes optic neuritis or direct injury to the 2nd cranial nerve? Isoniazid, rifampicin, ethambutol, streptomycin. Optic neuritis caused by ethambutol. Next question. Vitamin B6 is administered along with isoniazid to prevent discoloration of urine, edema, neuritis, dry mouth. And the answer is it is to prevent neuritis. Next question. Which of the following is not a broad spectrum antibiotic? Amoxicillin, cephalexin, tetracycline, clindamycin. And the answer is clindamycin. Next question. Teeth staining and dental caries are the main side effects of penicillin, tetracycline, vancomycin, azithromycin. It's tetracycline. Next question. The best birth control measure which can be adopted for a female on antibiotic therapy, barrier method, mini pills, progesterone only pills, estrogen pills. It's barrier method. Next question. A patient is on heparin therapy. All can be administered except azithromycin, cephalexin, doxycycline, vancomycin. Vancomycin. Next question. Crystalluria and megaloblastic anemia can be attributed to the use of penicillin, septran, amphotericin B and vancomycin. It's septran. Next question. Which of the following drug is photosensitive? Azithromycin, cephalexin, doxycycline, amphotericin. And the answer is amphotericin. Next question. When providing care to a patient with thrombocytopenia, avoid aspirin because interferes with platelet aggression, destroys thrombocytes, reduces circulation, produces hemolysis. It interferes with platelet aggregation. Next, captopril is antipyretic, diuretic, antihypertensive, antipsychotic. And the answer is antihypertensive. Next question. Streptokinase to be infused over 1 hour, 3 hour, 6 hour, 8 hours. And the answer is 1 hours. Next question. Agents which slows down heart rate is termed as negative ionotropic agents, dromotropic agents, chronotropic agent, negative chronotropic agent. It's negative chronotropic agents. Next question. What is the first drug of choice for MI? Paracetamol, streptokinase, morphine sulfate and heparin. And the answer is morphine sulfate. Next question. What is the expected side effects of sorbitrate? Dizziness, headache, hypertension, tachycardia. And the answer is headache. Next question. A patient is on long-term antacids. The nurse should caution the client regarding the chances of occurrence of fracture, dysrhythmia, paralysis, depression. It's fracture. The last question. The drug which is used to prevent contrast medium nephrotoxicity is acetaminophen, acetylcysteine, metformin, propranolol. It's acetylcysteine. And thank you to everyone.